Welcome, Fulbright FLTAs, to this session in your orientation on understanding the importance that United States colleges and universities place on the mental health of the members of their community and the mental health services that they offer on campus. With us today are two mental health specialists located in the MENA region, but who have years of experience working cross-culturally and who can speak to the mental health landscape in the United States from the perspective of those from the MENA region. Let me first introduce Dr. Ann Justice, who is a clinical psychologist by training and who holds the title of Director and Senior Clinical Psychologist at the Mahdi Psychology Center in Cairo, Egypt. Dr. Justice is a former member of the faculty in the Department of Psychology at the American University in Cairo, in Egypt, and is originally from the state of New York. Our second speaker is Mr. Nabil Salibi, who is the current Senior Director of the Center for Student Wellbeing at the American University in Cairo. Mr. Salibi is a trained psychologist and certified psychotherapist with degrees from the American University in Beirut, Lebanon. Ann and Nabil, welcome to our session. I'd like to begin with a question that might frame or set the context for the remaining part of the session, and that is, when accessing university websites, new students find a lot of information about campus resources. Some refer to mental health services and may specifically use the word counseling. Others refer to well-being, and still others combine mental health and well-being. I think it's a good starting point in this interview to clarify for the Fulbrighters what these terms mean. Nabil, let me start with you. What is meant by well-being, and what are counseling services?
Hello, thank you for having me with you today. It's a pleasure. So basically, when we talk about well-being, I mean, this is a broad concept, and it includes normally physical health or, physiological health and mental health or the mind. It's defined by the CDC, which is the Center for Disease Control and Prevention, as a person's judgment, a subjective feeling of their life satisfaction and own feelings. Counseling, on the other hand, or counseling services, caters to mental health, and it's defined by being a professional relationship, like one with a medical doctor, which empowers the individuals to accomplish mental health and personal development goals. Okay, so basically, counseling is the process which enhances mental well-being, which, as I said, is an integral part of the holistic well-being.
Thank you for that, Nabil. Ann, do U.S. universities frequently ask new students about the state of their mental health? And if so, why would they want to know this?
So for most graduate programs and also undergraduate programs, there's a part on the application that asks about mental health. And I think primarily the reason that a lot of universities do this is because they want to make sure they have enough providers on campus for any cohort of students that might have more mental health needs than others. I think also they do this just so they can get a read on who's coming in on what year, and also track if the student body changes from year to year and why that might be. I think a lot of people are hesitant to write on the forms if they have any sort of mental health, and that's totally understandable. Depending on the university, but most universities follow this very strict American law called HIPAA, which means any sort of medical information, including mental health information that you submit, stays confidential and is not shared with anyone.
Great. Thank you for that. And also, what services, briefly, do U.S. college campuses, do the counseling centers on these campuses offer?
There's a wide range, and you can usually go on the university's website and find the counseling center and click on it, and they're usually all listed. So it could be anything from mental health counseling, talking about depression, talking about anxiety, stress, talking about how it is to adjust to a new culture, to moving overseas, to roommate problems, anything like that. And then some also include things like study skills and time management. So usually there's a pretty wide range, and a lot of these mental health centers or well-being centers, whichever we're going to call them, also include psychiatric care, which would be medicine.
Okay, so even then, if I understand correctly, even if I, let's say, was feeling under pressure because of presentations that I would have to do coming up or research papers, and I'm a little bit worried, maybe I have a bit of a social phobia, I don't like to talk in front of people, I could use the services for that type of assistance?
You can use them really for anything, and they're free. And it will tell you on the website how to get in touch, how to make an appointment. And usually it's not the same day. So if you're giving a presentation, for example, on Thursday, you may not get an appointment on Wednesday. So you kind of want to plan ahead. Obviously, these centers have emergency appointments, but they probably wouldn't consider anxiety over a presentation an emergency. But yeah, you can go for anything from stress about a presentation to, like I said, roommate problems, boyfriend, girlfriend problems, whatever.
Great. Okay, that's good to know. Nabil, is there, in your opinion, less of a stigma in the U.S. toward receiving mental health counseling than there might be in the MENA region, or is it really now with the younger generation kind of the same?
So if it's okay, I just would like to add one thing. So basically, when we look at counseling centers, there should be an element that addresses prevention, intervention, and postvention. So this should be present in any counseling center. Prevention in terms of maybe an office that does awareness and outreach to the campus community. Intervention when there's a crisis, or even just as Dr. Ann described, when a student needs help addressing a certain issue. And postvention, I mean, God forbids a crisis happens and we need support groups or debriefing, professional debriefings. So we should always incorporate these three elements when we look at counseling centers and the services they provide.
Thanks. Let me ask my question again then. The next question, Nabil, is about stigma and the reluctance that some people would have to go forward to request counseling services because they might feel that, it's just not appropriate culturally for me to admit to possibly needing mental health support. Is that do you see a cultural component here or not?
I think many students internationally, I mean, even from my previous experience with a diverse campus population, over 110 nationalities that I've worked with in counseling, I've noticed that, yes, most students do feel that counseling centers are dedicated to deal only with students who have mental health disorders or impaired functioning, a sort of pathology. However, it is important to clarify that the mental health counselors that are usually hosted in any counseling center on campuses, they are trained to deal, as Dr. Ann said, with an array of issues, whether it's academic concerns, whether it's social anxiety, whether it's family disputes, whether it's relationship issues. And they are trained, of course, as well to deal with the upper spectrum where there is an impaired functioning or pathology like clinical depression or anxiety. Normally, my advice would be the moment a student, starts having doubts of whether they need to talk to someone or whether something is not working well, that's the moment where they should actually seek professional help.
Great. My next question, I'm going to ask Anne to start, but then Nabil, I'll ask if you want to add anything to this question, and that is, and according to a TED Talk that I saw on YouTube, 1 out of every 4 students will experience a mental health issue while they're in college. And the number of students in the last 10 years who have reported having a mental illness to their university has increased 5-fold. And in the last 15 years, students have become 27% more likely to experience mental illness. Do you have any insight as to why this might be happening?
So when you read the numbers, it's pretty shocking, right? And I think the normal reaction is, oh my God, are people getting sicker? I don't really think that's the case. I think as the years have gone by and mental health or mental illness, mental health has been destigmatized every year, it gets more and more accepted, that people are more willing to say like, hey, this is something I'm struggling with and I'm going to go ahead and get help, instead of being quiet or off by themselves, or maybe seeking treatments, assistance outside of campus. Also, over the last 15, 20 years, the university counseling system in the US, and I think broadly around the world, has changed as far as resources go. So counseling centers are growing, they're getting more funding, they're getting more, the people out on campus are realizing how important it is to have a healthy student body. And they're also doing more kind of outreach, just like Mr. Nabil said, programs on campuses, letting people know what they're about, how they're available, and really encouraging students to interact.
Thank you. Nabil, would you like to add to that?
Yeah, actually, I mean, yes, the stigmatization, I think, over the past 15, 20 years, as Dr. Ann said, is the major factor, that has normalized and increased demand on services. In the last 2 years, I guess, since the pandemic started, I mean, sadly, but truly, despite the lives lost and, shifting to a completely different lifestyle, the pandemic did raise more and more awareness. I mean, it brought mental health to the surface. Everyone was talking about well-being and mental health and how someone should take care of that. So yes, people became more open to talk about that. And not to forget that anyway, I mean, it's always been established that mental disorders or mental illnesses, the onset general age is during the 20s, during the early 20s. So this puts this category of students at risk of getting mental health issues.
Okay, so what I'm understanding is there's less stigmatization today than before. There are more resources, and so there's more. There's just, this would account for some of the increase, and we're not talking about this generation being less resilient or more prone to mental illness than previous generations. Okay, that's good to know.
Just one more thing to add, sorry, George, to interrupt. I mean, I do believe as well that, of course, the lifestyle today is very different than 20 years ago. And, it's very fast-paced. I mean, many people do attribute those reasons as well, and the development or the appearance of more issues related to mental health. So we do live in a fast-paced environment. The job market is saturated. There's uncertainty about the future. So yes, these factors do play a role. But I think the major factor, as we discussed, is the destigmatization of mental health and people becoming more open.
So it's not black and white. It's complex and it involves a number of factors. Would you also, and would you say that social media plays a role in how young people see themselves and in their self-esteem, and that this could lead to low self-esteem leading to perhaps mental health issues?
It's like you read my mind. I was just about to pop in and say, let's not forget social media. So for sure, over the last 10 years, the increase of social media has been huge. And even over the last years with the pandemic, I think more and more people are in touch with social media, whether that's healthier or less healthy. I mean, everybody's got a different opinion. But I think there is a lot of comparison. You're on your phone, right? And you're having kind of like a bummer day, and then you're scrolling, and you see all these images of people that are doing these wonderful things and everything looks happy and they have no problems. And then you're sitting, in your dorm room feeling like, this stinks. Like, why am I not out having fun? Like, they have the best life ever. Of course, no one puts their bad days on Instagram or TikTok. We just don't really do that. And so you get a very unrealistic view of how well other people are doing compared to yourself. So I think in that realm, it feels kind of yucky. And then people start to maybe slip down a little bit and have unrealistic expectations for themselves. On the flip side of that, also a lot of social media, especially since the pandemic, has been very pro mental health. So there's tons of TikToks, there's tons of Instagram accounts, including my own, which try to promote, mental well-being, prevention, speaking out when you're having a hard time. So I think it kind of goes both ways.
And thank you. And you mentioned something about, you used the term realistic expectations. And I'm going to ask about that a little bit later on because, in fact, I think maybe in this upcoming question, I will touch on that. And it's really important. In another TED Talk that I listened to, some of the reasons identified at universities for students to experience anxiety and depression included academic stressors, such as difficulty coping with the requirements of a course or difficulty understanding the material. 2 was a lack of financial resources. 3 was relationships with others. 4 was changing expectations or not understanding what the reality of living on a campus was going to be, having very high expectations for being in the US and not having these expectations met. And then finally was just simply being in an unfamiliar environment. So our Fulbrighters will not only be in an unfamiliar environment geographically, but culturally. So my question is, would you recommend that these Fulbrighters come to the United States with realistic expectations for their having some difficulties that will require perseverance and resilience, at least a little, instead of believing that the entire year is going to be great? And in other words, does having less expectations or less than perfect expectations result in better coping?
Yes, I think having what we would call like realistic expectations is a much smarter, healthier way to go. It's also kind of hard to figure out what is a realistic expectation. The things that we see about the US on TV, sadly, are not always true. And so I've worked with lots of clients in the past and students in the past who, are going to California, for example, or to New York, for example, and they think they're going, like in the situation of the clients I've worked with that are going to New York, they think they're going to show up in New York and it's going to be just like Friends, the TV show. But that's not reality. Or they think they're going to California and it's going to be all sunny days and beach time, and that's just not reality. I think wherever we live on the whole planet, you're going to have good days and bad days. And you'll have days that do look like you see on TV and the movies. And then you'll have days that are not so fun and you're eating noodles in your dorm room, working on spreadsheets. That's kind of real life. But also, realistic expectations. So maybe some of that could be talking with previous people who've gone through the program at that university, or getting hooked up with a buddy or someone at the university to kind of figure out what it's actually like before you touch ground.
Sure. Nabil?
Yeah, I think exactly. The problem lies with defining what a realistic expectation would be or what to expect, So I don't think it's very healthy to have low expectations, because the students need to enjoy their experience, right? And see things firsthand rather than going there, not expecting that things are going to be good or expecting that things are going to be bad. I mean, yes, it's normal that starting college or moving from one culture to another, it is a life-changing event. And there are definitely some feelings that will pop up at some point, whether it's loneliness, separation, homesickness. And, there are trained people who can help with that, counselors. And it differs from one person to another. I mean, some people are more resilient, they will adapt faster, adjust faster. Other people, it might take longer depending on their personality and psychological traits. But again, I mean, when they feel that they need help, they should ask for professional help in order to adjust faster.
Great. Nabil, let me continue with you on the next question. It's natural to expect that our Fulbrighters coming to the United States and having to adjust to a new culture far away from home might experience feelings of loneliness, separation, and isolation, particularly when adjusting to the new culture. Maybe, in the first maybe not in the first few weeks. They might be, in a kind of honeymoon phase, but then, with the weather changing and getting colder and academic demands getting more intense as the semester goes on, they might start having, these certain feelings. Would it be okay for them to contact the counseling services if they need to just to talk to someone about how they feel?
Yeah, exactly. I mean, this is what I recommend. I mean, I've seen before, many students are skeptical, especially from the MENA region, when it comes to seeking professional help on campus, in fear whether, the records might be disclosed to third parties, like family, faculty members, or even university administrators. But I can assure that everything that is said in a counseling session remains with the counselor. These records are protected, and the students really need to seek that help in this private environment. The only time when confidentiality is breached in counseling is when there's an imminent risk of harm to self or others. And even then, the confidentiality will be breached with the minimum required information just for the benefit of the student in order to safeguard them.
Okay, and for our listening audience, I want to remind you of what Dr. Ant said about making appointments at counseling centers, and that you may find that the center can't see you immediately, and you need to think about booking in advance. So that's a very important point that I want to reiterate for our audience. Thank you, Nabil, for that information.
And George, I was going to say, can I add one thing? In
Sure.
all my years working in university counseling centers, the beginning of the semester is always the slowest. So it's always easiest to get appointments in the beginning. As midterms happen and finals happen, that's when it tends to get really hard to find an appointment. So if people are thinking about using these resources, which again, I can't say it enough, this is totally a normal thing to do. I would recommend, checking out the website, seeing what the services are, and taking advantage of it in the beginning so you have a relationship with a counselor or with the center. So if you do need something, further in the semester or further in the year, you already have that relationship. You're not just showing up cold as a first timer.
Okay, so you can actually build a relationship with a counseling center and become somebody who's known, and then they'll better understand your issues the next time you go. Is it normal to see the same counselor? Is that how counseling centers work? Are they assigned to a person and that person follows with them as they progress?
So each counseling center has their own setup. Most counseling centers and counseling just as a profession, we prefer that you stay with the same counselor if possible. A lot of centers will have someone that does the first appointment, kind of like an intake, finding out what your needs are, and then they assign you with a counselor that's best suited towards your needs. Not all of them do that. Sometimes you show up and the person that you meet the first day is the person that you're assigned to. Of course, if you don't feel like the person that you're assigned to is not a good fit for whatever reason, or you feel uncomfortable for whatever reason, it's your right to request to have a different therapist, and that's totally okay.
Okay, great. And let me continue with you on the next in terms, and Nabil just mentioned something important about confidentiality. So I want to ask you, in terms of confidentiality, how are counseling sessions handled at the US universities? And you mentioned something called HIPAA, HIPAA. How does this work to the benefit of the client and the counselor?
So HIPAA is a US law. It's a medical and healthcare law that says whatever information you disclose to a healthcare provider, whether it's a counselor or a physician, psychiatrist, whomever, whatever information that you disclose stays confidential, meaning that if your mom calls your roommate, your teacher, your boss, whoever, they cannot say anything at all. The only person that they could disclose information to is if you write someone as your emergency contact person, and in fact, you're in an emergency. That could include, like Mr. Nabil was saying, if the counselor thinks that you might hurt yourself or hurt someone else, they'll take steps as much as possible to protect all of your information while making sure you get the help that you need as quickly as possible. But for sure, if your mom or grandma, whoever calls the university counseling center, they can neither confirm nor deny that they've ever seen you. So they can't tell anyone anything.
Thank you. You just anticipated my next question. I'm going to ask Nabil, because Nabil, now in your current role as a senior director of a Center for Student Wellbeing at an American style university in Egypt, what do you say if a parent calls you about student X and wants to know if her or his son or daughter has been to your center to see a counselor? What is the typical response that you give?
Yeah, as Dr. Ann was saying, I mean, the typical answer is we can neither verify nor deny whether your son or daughter are receiving counseling services. Our records are protected by law and cannot be shared with any third party without the written, explicit consent and signature from the student himself or herself. And just to add on Dr. Ann's answer as well, I mean, I think for universities, for campuses, the treatment records are protected under FERPA, which is the Family Educational Rights and Privacy Act. So they have the education records and treatment records under FERPA, which is very, very similar to HIPAA as well, where nothing can be disclosed to any third party without the written consent of the student.
Thank you for that, for mentioning FERPA as well. I wanted to ask you as well, if a student, let's say, is seeing a counselor and agrees to share or to allow information to be conveyed to someone else, does that give a kind of a blank check to the counselor to continue to talk about this particular student, or is this a very specific situation that is carefully contained? And I see you shaking your head. So would you like to answer that?
Yeah, so basically,
Okay.
Oh, go ahead then if you want to answer.
I was just going to say,
we were both shaking our heads.
Oh, sorry, I couldn't.
But that's good. We're in agreement. So I'm a huge nerd about this, and I've been living in Cairo since 2007, and it's kind of not so much now, but kind of a new concept that if someone gives me consent to talk with anyone, there's a limited window, and what I can talk about is a very limited window. So for example, if you're my client and you want me to talk to your husband, whatever, there's a consent form, like Mr. Beal was saying, that's written that you sign. You know, Dr. Ann is allowed to talk to this person for, you know, between December 1 and December 4, or however you choose, about these issues, school stress, whatever. Sometimes there's this part on the form, and I always have this part, Dr. Ann is not permitted to discuss X, Y, Z. So it's a very limited window and a very limited scope of what we're allowed to talk about. And, you know, our training is so super strict that we really, really adhere to this.
Good. Nabil,
Yeah,
please add to that.
Yeah, I totally agree with what Dr. Ann said. And even, I mean, wherever I've been working, I reinforced on the release of information form that they specify exactly what is going to be released. So for example, when an office mandates a student to counseling, we limit the information that's going to be shared only to attendance at counseling, just to be able to notify that the student has been attending the sessions, because there are some sanctions if they don't, if it's been a mandate. But anything else, no, I mean, they need to specify whether it's recommendation, whether it's summary of symptoms, and what's the purpose, if it's for coordination for care or sanctions or any other purposes that might be included in that time frame that Dr. Ann said. It's not like a consent that's going to be used all the time to release all sorts of information. This is totally unacceptable and unethical.
Thank you for that. Nabil, let me continue with you and ask you a question about academics. And one of the relationships that a student has is with the faculty. And, I don't know if this has happened, but it's just a scenario where a student might be academically struggling in a class or failing a class, and that student might go to the professor and say, I've been dealing with some mental health issues lately that have prevented me from being able to perform as I should in your class. And if you would like to talk to my counselor about this, this is my counselor's telephone number or email address, and she can or he can explain to you the problems I've been having. What would the professor probably say in the United States to that type of discussion? Nabil?
Yes, I believe that the professor should not take what the student is saying for granted, or even take the phone and accept talking to the counselor. If there's anything official, any documents that are official, whether from the counseling office as support letters, which some universities provide, or service letters just to prove that the student has been receiving services, then that could be used by the student with faculty. But the student cannot just come to the faculty and say, I've been passing through this, can I pass the course? I mean, the faculty needs to send the student back to the concerned department, and if there's any need identified, then that letter will be issued in support of the student.
Yeah, and did you want to add to that? I know you are former faculty, and this may have been something that you experienced.
Sure. What happens, and this does happen frequently, is that a student will say, I'm having a rough time or whatever is going on, and ask the faculty, please call my therapist. Even if the faculty does call the therapist, remember, the therapist can't confirm nor deny that they've ever seen the student without written consent. So there's all these stopgaps in place. So even if you said, please call my counselor, nothing would come of it unless that you had spoken with the counselor, requested that they write a letter like Mr. Nabil was saying. But again, it's all really, really confidential.
Okay, that's good to know. Let me continue and ask a question about accommodations. What are accommodations? And as faculty or former faculty, you and I are familiar with the types of letters and emails that we would receive when teaching that tell us that a certain student is entitled to accommodations for a verified disability. Now, Nabil, you generate these types of letters from your office, so I'll get to you in a moment. But Anne, our Fulbrighters will be teaching as part of their grant. So what should they do if they receive one of these, either in like hard copy or by email, asking them to sign, perhaps to verify that they've received it for one of their students?
So I would ask to meet with the student and say, I received this. Can you tell me a little bit more about what's going on for you? And then, they, by law, they have to do the accommodation. Usually accommodations are extra time for a test, for example, or taking a test in a silent area, not around other students. There's various accommodations, but usually it's not a big deal. You just want to speak with the student, make sure that they know that you're all on the same page. Also, some schools don't send out accommodation letters. It's up to the student to decide which professors they want to know that they're entitled to accommodations, because they may not want to tell every professor, or they may not need, for example, extra time in every subject.
That's a really good point. Nabil, in your experience as the director of a center, you have student disability services. I have two questions. One is about something that Dr. Ann just said, which is that some students may need or may qualify for accommodations, but not choose to share that information with a professor. And the other question is, if a student who qualifies for an accommodation does share this information or present something to a professor, how obligated is the professor to comply with what's on the what is in the instructions for the accommodation, such as giving extra time, allowing for frequent breaks, sitting in a particular place in a room, things like that? How obligated is the professor to do to actually comply with these requests?
I mean, professors, especially in the States, are obligated by law, by ADA, to follow these accommodations and provide whatever accommodations are deemed necessary for the students. To explain for Fulbrighters what accommodations really are, they are actually forms of assistance, that are leveling the ground between students that have a disability in order to be able to perform and have equal opportunities as their peer students. And when we say disabilities, it could be physical or mental impairment, which is usually hidden disabilities, or a person who is perceived by others as having such an impairment. Okay, so what they do is they level up the ground, and they are needed in order for the student to be able to perform equally.
So thank you. You mentioned something I was going to ask about, which is a hidden disability. Can you give an example of a hidden disability? Because obviously we can't see it as professors or faculty members. We don't know that it's not apparent when the student enters the room that this disability exists.
Yeah, I mean, I'm sure like when Fulbrighters are going to come to the US, they're going to see visible disabilities on campus, right? Whether it's visual impairment or motor disabilities or things that are actually visible. And normally faculty, unfortunately, they empathize maybe more with people who have visible disabilities than people who have hidden disabilities. And by hidden disabilities, we mean things that we cannot see with our eye, We're talking about severe depression, we're talking about learning disorders, ADHD, we're talking about chronic illnesses, epilepsy, brain injuries, all sorts of, medical conditions and psychological conditions that we cannot actually detect just by looking at the person.
Thank you for that. And so for our audience, understand that students may present with physical, motor, visual, or hidden disabilities. And if they have accommodations, then it is by law a requirement for us to accommodate them. And importantly, Nabil, as you said, it is not to give an advantage to a student. So we're talking about, okay, this student X has extra time on an exam, that's not fair. But that's not a correct interpretation of an accommodation. What we are saying is this student had a disadvantage to begin with, and we are simply bringing this student up to the level of the other students in the class so that it is actually an equal and equitable playing field. Is that my understanding correct?
Exactly. That's what we're doing. Because some students, sometimes they complain like, why does this student, have 20% or 30% more time on an exam? And this is when we explain equality versus equity, because that person needs that time, right?
Okay.
And just to add one more thing, George, before we move on, since we've talked about faculty receiving letters, normally the centers, the disability services will not disclose the type of disability to the faculty. So the letters they receive will just say that this student has a verified disabilities and these accommodations need to be followed. It's up to the student whether they want to talk to their faculty and explain about their condition, but this is by law absolutely unnecessary.
Okay, and then just to clarify, if the other students knew about this accommodation, it would be from the student. It wouldn't be from the faculty member, because the faculty member is not going to share this information with other students. Is that correct?
Of course, yes.
Right. So there's no cause for the student to feel, well, I'm going to be embarrassed by the fact that I'm disclosing a disability, because no one else is going to know. Unless, I mean, it's it's an obvious disability, but if it's a hidden disability, then it's really the student, between the student and the faculty member. Okay.
There's also, I was going to say,
yes,
there's one more point to that also. As our Fulbrighters go and are teaching, which is very exciting, it's also important to remind them that if you receive one of these letters as a faculty member, you can't talk to anybody about it. So you can't make any sort of announcements in class alluding to this person's going to take the exam in a different room, for example. You can't say anything. That you can only communicate with that exact student about whatever accommodations they're requesting.
Good. That's good to know. That'll be very helpful, I think, for our Fulbrighters if they're in that type of situation. Um, Let me ask you, Anne, to continue on this, if an FLTA going to the US had a verified disability, how would he or she make that known to the university?
It's a personal choice, and they may choose not to. If you wanted to make it known to the university, I would, in what way? I would certainly talk to whoever is your hiring faculty member. So if you're teaching Arabic, for example, I would go to the head of that department and speak with them if it's something that you need extra support with or accommodations for. And this will be something they're really familiar with. It's so common in the US, and like we keep saying, it's law that we all have to make accommodations for faculty and also for students. So you're not asking for anything special or for favors. It's not like that at all. You're just saying, for example, if you have a hearing impairment, maybe you need some extra equipment in the classroom. Totally fine. You just need to ask for it.
Great. Nabil, did you want to add to that?
Yeah, and I think even like if the student doesn't want to disclose what type of disability or that they need help to the faculty or the advisor or the chair or whoever, they can simply just ask for counseling. Dr. Ann said they could look up on the website and see where the services are located, and they can just, see where the disability office is or accommodations. The title varies for the office from one university to another, but it normally includes accommodations and accessibility. So they just locate that and they reach out straight to that center that's going to issue their accommodation letters confidentially.
Great. Nabil, let me continue with you on the next question, which is, we talked about this a little bit briefly. If a student has not requested accommodations from a university and therefore isn't officially entitled to them, what should an instructor do if the student talks to the professor about saying he has a disability that is impacting performance and requests extra time on exams or requests a deadline extension on a paper?
Yeah, I mean, again, faculty do have the freedom to run their classes the way they want to run them. So someone maybe would just accept that from the student and give that accommodation. But I mean, to follow policy and, to abide by the regulations, the faculty member should just tell the student, if you do have a verified disability, then please, register with the office and get the official accommodation letters. That would be the official proper route to go.
Okay. Anne, let me ask you this question about taboo topics. Are there any taboo topics at counseling centers in the United States? Do counselors act as judges or of clients' behavior or make recommendations based on a value system? I see you shaking your head.
No, I love this question. Absolutely not. So the whole point of having a counseling center is for everyone to go and feel safe and not feel judged. And for sure, if you happen to feel judged, speak up and ask for a different therapist, for sure. But the therapist training, the whole background of it is to create a safe environment where you can say whatever you want about anything, sexuality, religion, whatever you want. And it should be a safe space where you can feel comfortable talking about it 100% without judgment.
That's good to know. Nabil, in your center, have you had discussions with the counselors about this, about maintaining a kind of non-judgmental approach to counseling students?
Yeah, definitely. I mean, I have worked in the MENA region, and I know that sometimes counselors do hold, some beliefs, values that might conflict with a student's values, right? And ethically, whenever that clash happens, whenever the counselor feels that they cannot accommodate the student or the values are clashing, they should refer that student to someone else, But in general, I mean, as Dr. Ann said, I mean, most counselors by training are open to work with all issues, even the taboo issues in the region, in the MENA region, whether it's sexuality, sexual identity, religious issues, even substance use. So the counselor should have the openness, training, and willingness to work with these issues.
Great, that's really important to know because I think that will allay some of the concerns that Fulbrighters might have in wanting to discuss issues, but not knowing if these issues were going to shock the counselor. So it's good to know that counselors are trained to and probably have heard everything and can deal with just about anything in a value-free way. I've noticed that, according to statistics, between 2007 and 2015, the number of student deaths by suicide increased by 75%. What are some of the warning signs that university counseling centers look out for? And if one of our Fulbright FLTAs was concerned about a friend or a student, would they be doing the appropriate thing by reaching out to a counselor on behalf of this person, of the friend or the student? And are there numbers on campus to call, and where are these numbers posted? Anne?
So for sure, the faculty member could reach out to the counseling center.
And you're muted, I
think.
Oh, there
Am
you
I still?
No,
okay.
Good.
For sure, the faculty member could reach out to the counseling center to discuss their own concerns about a student, but that doesn't mean the counseling center is going to contact the student. Again, it's getting counseling. It needs to come from the individual who wants the counseling. If suicidality is an imminent risk, meaning that you as a faculty member think, for example, your student is really, really, really at risk, I would say check out the policy manuals. Most centers have an emergency number, like a 24-hour emergency number, which you could call. You could also talk to whoever is head of your department. So it really depends on the university structure. If the concern is for a friend, not necessarily a student, then that's a little bit different. So if the concern is for a friend, you could invite the friend to go to the counseling office with you for an appointment. Or perhaps you want to make an appointment to talk about how this is really bothering you with a counselor and get all of the up-to-date information. As far as where to find these hotlines, again, go to the counseling center website. Probably also they're posted all over campus. Usually we post things like that in the library, in the Welcome Center. Usually the hotlines are kind of everywhere, but for sure on the website.
Yeah, Nabil, did you want to add to that?
Yeah, as Dr. Ann said, I mean, normally, the numbers are posted everywhere on the websites. So whether it's an emergency where there's imminent risk, then automatically medical services should be informed as well, or the emergency team, depending on the campus policies. And I think it's everyone's responsibility. I mean, it's faculty's responsibility, students' responsibility to look for signs. I mean, you've asked for warning signs, and I can share some. Basically, what we're looking for is drastic change. Any sudden or drastic change in one's behavior could indicate that the person is passing through a rough time and needs help. So it's important to keep an eye for that. I mean, faculty could look for a sudden disappearance from a class, a recent drop in achievement. Others could see worrisome written or verbal disclosures when there's risk of harm to self or others. There could be social isolation or withdrawal after the person has been engaged and then suddenly they just withdraw. General problems with attention or concentration, poor hygiene, any bizarre behavior, substance abuse, and the dependency on a faculty member or an advisor.
Great. My final question is an open question to you. Are there any other points before we conclude that you think our audience would benefit from knowing? Anne?
I mean, I would say the main thing is this is an amazing opportunity, and you've been chosen because you're up to the opportunity and up to the challenge. So my last couple words would be dive in, have fun, immerse yourself in the culture, get to know other Americans, get to know other international people at the school, take advantage of every opportunity that comes your way, including the counseling center. But get out there, dive in, and you'll have some days that are better than others, and that's okay. That's a normal human thing. if you find yourself, kind of holing away in the cave of your dorm room or your apartment, and it's been more than a day or so, that's probably a good sign to force yourself to get out. And if you want to ask for some extra support, absolutely do it. But again, this is such a fantastic opportunity, and I'm so excited and proud of all of you, and I hope you have a great year. Oh, George, you're muted.
Yeah, thank you for that. That's really inspirational. Nabil, did you want to give final words?
Yeah, I mean, I totally agree with what Dr. Ann said. I mean, after all, it is an opportunity that they have been chosen, and they should enjoy that opportunity. However, I just want to emphasize again the importance of well-being, especially mental health well-being. So whenever they need, I mean, this service is available, it's confidential as we described. So don't hesitate, don't worry about taboos, don't worry about confidentiality. It's a private service, it's a free service. If you just want to talk to someone, just do it. Go ahead and use the service. There are professional people trained who will help you, process these feelings and help you work on your insecurities and yourself in general.
Thank you for that. To our audience, this concludes our session on mental health services, understanding mental health services at U.S. colleges and universities. I'd like to thank our mental health specialists today, Dr. Ann Justice and Mr. Nabil Salibi, for providing us with some really important information on what to expect, how to use the services, how to enjoy this opportunity in the U.S., and that there will be some good days and some bad days, and that on those bad days, there's always support for you if you need it. Thank you so much, Ann and Nabil, and have a great rest of your weekend. Take care.